different factors can affect our capacity to maintain homeostatic conditions in the internal environment for optimal conditions. So we're going to look at two things today. First of all, we are going to look at temperature. And by the way, a bit of a health warning here. There is quite a lot of, it's quite wordy, this tutorial. So hang in there and keep the concentration levels nice and high, okay? Because what we're going to talk about is we're going to talk about high temperature, and we're also going to talk about low temperature. But beyond that, as well as humidity later on, but beyond that, we are also going to look at the differences between acute impacts of high temperature and acute impacts of low temperature. But later on, we're going to look at chronic impact. So for example, if you're at high temperature just once temporarily, or you exercise just for one bout and you get hotter, that's acute. But if we do it again and again and again and again, or we live in a hot climate, then of course that's going to be more chronic. So what we're going to do first is we're going to look at the acute factors. Well, the most important thing with regard to high temperature experiences is that the vascular system, the cardiac system, and also the control systems are going to cause a redistribution of, and I'm going to use the symbol Q dot. This means cardiac output. If you haven't done the cardiac values session, I'm sure you will do at some point. But cardiac output is the amount of blood leaving the heart per minute and where we distribute that blood to. So of course, when we are in hot conditions, what we might do is we might distribute that more towards the skin and less towards, for example, the core of the body, because the blood can then pass by the skin and we can cool the blood down a little bit. The other factor we might want to consider before we look at advantages and disadvantages is also the notion of sweating and the evaporation effect. When we are in hot conditions, hypothalamus will instigate the sweating response, which causes moisture to leave the skin with some minerals as well, electrolyte, and that sweating will lead to evaporation from the skin and will help to cool us down. Now, remember, we are in acute conditions here. There are certain things about this which are negative, and I'm going to do them like this. There's problems with this. First of all, we might, and think about a performer when you talk about this, or even someone who's out on a long hill walk or something, they're going to experience a loss of fluid. That's going to lead to things like increased viscosity of blood because of a loss of plasma. It could lead to cardiovascular drift. It could even lead to dehydration, and worst case, even lead to death, which is obviously a very, very serious health condition. But also, I just want to remind you that if we're doing an if that activity, let's say hill walking, is greater than 20 minutes, we could experience cardiovascular drift. And if you don't recall what cardiovascular drift is, it's when we do not exercise harder, but our heart rate goes up anyway. Why? Because our blood becomes thicker, because we're dehydrated, and therefore heart rate has to compensate. But there are lots of positives too to experiences of acute warm conditions, and they're the following things. First of all, muscles go up. They become more pliable. That's fantastic. Muscles become it's a natural warmth, isn't it? Muscles become more pliable. Wonderful. Another positive is we get an increase. That's an up arrow, by the way, as is that one. I'm not sure it's clear. We get an up arrow, faster speed of nerve transmission. Nerve firing itself, the signals to the muscles, for example, become more rapid, and therefore things like our response times decrease. We become faster to react, for example. That's fantastic, right? Also, another positive, we are less likely, down arrow, likely to get a soft tissue injury. Okay, so if you think about a strain or a sprain, for example, we're less likely to experience those in hot conditions. Now, there are some counter arguments to that, such as very dry, hard ground, for example, but I won't get into that right now. We're just looking at temperature. Now, and final on, we get a decreased viscosity, thickness of synovial fluid. And if you're not sure what synovial fluid is, if we talk about synovial joints, these are basically the joints you move, you're able to rotate around in any sporting action or exercise action. They're filled with synovial fluid. That's the moisturizing part of a joint, and if that becomes less viscous, less sticky, then we can move through greater ranges of motion more comfortably. So that's fantastic, right? But also, what about the low temperature? Let's go back a bit. What if we go into low temperatures, what happens to us? Well, first of all, we get, guess what? A redistribution of blood. Nothing surprising there. We've just talked about that. But unlike redistribution of cardiac output, but unlike here, where more cardiac output will go to the skin for cooling, of course, when we're in cold temperatures, more is going to go to the core, because it needs to be its temperature maintained. We're also going to have the experience potentially of shivering. That's that efferent autonomic response of contraction of skeletal muscles. And also remember, we've got those erector pili muscles, or never have to say that word, erector pili or pili, you choose whichever pronunciation you want. Those will cause hairs, fine hairs on the surface of the skin to stand up and catch that layer of air and make it slightly insulating. So there are positives and negatives to being in cold conditions temporarily. So let's look at the negatives. Well, guess what? In fact, I tell you what, folks, tell you what I'm going to do. I'm actually going to go to here. I'm going to copy this stuff here. Am I going to copy it? It didn't work last time I tried this, so hopefully it's going to work. Command C, and what I'm going to do is I'm going to drag this over, all being well. Please work. There we go. I'm going to drag this over, and basically all of the positives of being in warm weather we're now going to turn negative. Muscles negatively become less pliable. No surprise. Speed of nerve transmission goes down. No surprise. We are now negatively more likely to experience soft tissue injury, such as a strained muscle. Negatively now, our viscosity of synovial fluid goes up. It becomes stickier and thicker, and these are negatives for us. So, of course, we get the opposite effect as a result there. Now, the other thing we want to do... yeah, absolutely fine. Now, the other thing we want to do here is we want to look at the chronic factors. So, rather than now talking about the acute, we're now going to talk about the chronic. What if we are in hot temperatures again and again? We live near the equator. It's the summer months and we're training through that. Whatever it might be, what is going to happen here? Well, first of all, folks, we need a process of acclimation. Okay, so when we are in hot temperatures, you probably know this when you go on holiday, or you might live in a hot country yourself, acclimation needs to take place. And we can go through HAT, this is a little acronym here. This is called heat acclimation training. Heat acclimation training is quite effective, and it can last for 3 to 4 weeks, even if it's not hot any longer. So by training, for example, in warm conditions, we can experience HAT, heat acclimation training, and that has certain positive effects. Now, let's look at the negatives and the positives of being in hot temperature with regard to sort of bodily function. Well, negatives first of all. What we find is the effects that we get are temporary, okay? It wears off. The other thing is, if we are training in really hot temperatures, we have the potential for reduced quality of training. If you're in really hot conditions, it's actually hard to train as effectively as if you're not. So those are some difficulties in my experience, but there are loads of positives, which is why warm weather training is very, very common with good quality athletes and performers. So what would we expect? We get increased tolerance to heat. Okay, which within movement, within sport, within performance, within competition is effective. Also, we get this positive. We get a decreased chance of heat illnesses. You know, things like sunstroke, for example. So some Olympic athlete, for example, who goes through warm weather training and then goes to, let's say, the 2020 Olympic Games in Japan, where it was really, really hot, the chance of heat illness when there would be less. They get up arrow, they get an improved thermal comfort. And what we mean by that is being in hot conditions, performing in hot conditions becomes more comfortable to a person. This is an interesting one. People have a decreased perception of effort. So we could talk about Borg scales here. Borg scale is a rate of perceived exertion. We can say between 6 and 20 how hard we think we're working. People who train in hot temperatures perceive their work rate as lower overall on average. Also, a couple of other points, because we're in hot conditions lots, guys, have a look at this. We experience earlier onset of sweating. Now, when you go out clubbing, this is not what you want, is it? But when you need to cool down, it's pretty effective. You don't want to be the clammy one in the club, probably, but it does happen sometimes. And finally, another positive is that the human body becomes better able at conserving sodium chloride. We actually release less minerals, electrolytes into our sweat. We have a lower sweat concentration, and therefore we conserve or preserve for sodium salt for utilization. Now, I know it feels like we've got a lot going on here, but we're now going to start speeding up. We also have chronic impacts of being at cold temperatures over time. So there's negatives. Let's get this done very, very quickly. The one negative I want to raise for you is that what I'm about to say, the following, it's more impacting for men. Okay, so it might be less impacting for women, but of course that depends how you perceive that. But the positives of being in cold conditions are as follows. We get an increase in fat metabolism. So people training in cold conditions go through beta oxidation or fat metabolism in greater efficiency and greater quantity. And finally, the other positive here, we also get what we call cold induced excretion of ketones. Now, ketones are excreted in urine, and if you've ever done sort of like a keto diet, it's what it refers to here. It's actually a way of passing fat through the urine, or converting and passing through urine, and it can actually lead to kind of maintenance and balance of weight, for example. Now, you probably think I've done enough with you already, and I kind of have, I suppose, but I just want to quickly talk to you about humidity. Now, rest assured, this is going to be much faster because a lot of it is copied over. So we're going to say high humidity. Remember, humidity is the amount of water vapor that's in the air, and we're going to talk about low humidity conditions. And first of all, we're going to talk about this acutely, and we'll do it on both sides. So what happens acutely if we train or if we are on one occasion in high humid conditions? Well, basically it's similar to heat. Okay, so all the effects of heat we've talked about would be similar. However, we would experience more sweating. So of course there are certain negatives that occur with this. Because we sweat more, because we effectively get earlier onset exhaustion. So we're more likely to exhaust faster in humid conditions, and it can be, some studies have shown that it can be as low as 45 minutes even for elite athletes. Okay, now the impacts of acute low humidity, there are a couple of positives in here. Okay, so the positives are as follows. So we've got later arrival at exhaustion, so later exhaustion. So if we're not at altitude, we might be able to keep going for longer, basically. One of the positives is we get less sweating, therefore we're going to dehydrate less commonly. Furthermore, we're going to get more impact from cooling mechanisms. So for example, even if it's a hot temperature and low humidity, if you use cooling mechanisms such as ice and or even starting to sweat, for example, what's going to happen here is they're going to be more impactful. But also, one of the things we want to be aware of is that we've also got our chronic impacts of training at high humidity, and people sort of try and replicate this sometimes by going and training in saunas or steam rooms and this kind of thing. What is the long-term positive? Well, overall, it's meant to be green. Positive, we might get increased levels of plasma, so more plasma in the blood. We can get up to, one positive is we get up to 26% greater rate of sweating. Now you might think, ugh, but actually sweating is the cooling mechanism. That's really, really positive. And also our sodium concentration, so our Na concentration, but I'll say concentration in sweat decreases. So yes, we sweat, but the amount of minerals we lose in that sweat are less. Thanks.